So let's start with this subject, and before starting this subject, I want everyone to involve in this because biochemistry is something which you have to give a lot of answers right here. Now last part, first we talk about the carbohydrate metabolism. Sir, the carbohydrate metabolism, we have to talk about the pathway, we have to talk about the site, and we have to talk about the rate limiting enzyme, sir. Sir, in this first, we have to talk about the glycolysis, where the energy, the glucose is getting from the pyruvate, sir. Glycolysis or embedded Meyer-Hof pathway is another name of a glycolysis. Done, sir? First thing. Second, the site is cytosol. Cytosol. Glycolysis or embedded Meyer-Hof pathway, the site is cytosol. The rate limiting enzyme is phosphofructokinase 1. Simple, fruity. Phosphofructokinase 1. Phosphofructokinase 1. Second, the cycle pathway you have to remember is Krebs cycle. The another name of Krebs cycle is 𝗖𝗵𝗆 cycle, tricyclic acid cycle, also called as citric acid cycle. The three names for the one cycle, and that is going to be your Krebs cycle, 𝗖𝗵𝗆 cycle, citric acid cycle, and where they are going to take place? Mitochondrial matrix. And now the citric acid cycle will tell you about the rate limiting enzyme, that is isocitrate dehydrogenase. That is going to be what, sir? Isocitrate dehydrogenase. Isocitrate dehydrogenase. The two things we have studied, that is glycolysis, which is also called as embedded Meyer-Hof pathway, and the rate limiting enzyme is phosphofructokinase 1. Krebs cycle, 𝗖𝗵𝗆 cycle or citric acid cycle, the rate limiting enzyme is isocitrate dehydrogenase. Isocitrate dehydrogenase. The third thing which we have to focus right here, sir, the third thing is gluconeogenesis. New glucose is formed in liver and kidney. Where in liver and kidney? Cytosol and mitochondria. Liver and kidney. Now, the new glucose is formed. It is like a fructose. To remember, fructose 1,6-bisphosphate. Fructose 1,6-bisphosphate. Fourth thing is glycogenesis, formation of glycogen. The extra glucose is stored in the form of glycogen. So remember where it is taking place? Liver and skeletal muscle. Where in liver and skeletal muscle? Cytosol is the place, right, sir? Now, sir, glycogenesis is formation. So rate limiting enzyme is glycogen synthase. And glycogenolysis, that means breakdown of the glycogen. This is again taking place in liver and skeletal muscle. That is your cytosol. And rate limiting enzyme is going to be the glycogen phosphorylase. Done, sir? Sixth is 𝗵𝗵𝗆 shunt or pentose phosphate pathway. In this, it is going to take place is again liver and skeletal muscle. Where in liver and skeletal muscle? In the cytosol. And here also the rate limiting enzyme you have to remember, 𝗔6PD, that is glucose 6-phosphate dehydrogenation. Now one by one you have to answer all of this. You have to mug it along with me, sir. Number one is glycolysis or embedded Meyer-Hof pathway. What is a rate limiting enzyme right here, sir? Glycolysis or embedded Meyer-Hof pathway. What is a rate limiting enzyme right here, sir? Phosphofructokinase 1. Very good answer. Second is Krebs cycle, 𝗖𝗵𝗆 cycle or citric acid cycle. What is a rate limiting enzyme we are having, sir? It is isocitrate dehydrogenase. Then gluconeogenesis. Fructose 1,6-bisphosphate. Glycogenesis. Very good. It is glycogen synthase. Glycogenolysis. This is going to be glycogen phosphorus. 𝗵𝗵𝗆 shunt or pentose phosphate pathway. This is going to be 𝗔6PD. Very nice. Now let's talk about another protein metabolism. First, carbohydrate metabolism is clear to all of you. Now coming to the protein metabolism, my dear friend. Protein metabolism, number one pathway is urea cycle or ornithine cycle, sir. Urea cycle or ornithine cycle, sir. This is taken place in the liver, cytosol and mitochondria, sir. The rate limiting enzyme is CPS1, that is carbamoyl phosphate synthase 1. Urea cycle liver में take place कर रहा है. The rate limiting enzyme is CPS1, that is carbamoyl phosphate synthase 1. Carbamoyl phosphate synthase 1. Now coming to the lipid metabolism, my dear friends. The four things we have to read in the lipid: beta oxidation, keto, fatty acid, and your cholesterol synthesis. So very important to know where they are occurring. So beta and ketogenesis, they are occurring in the mitochondria, my dear friends. And fatty acid synthesis and the cholesterol synthesis, they are happening in the cytosol. The fatty acid and cholesterol, they are in the cytosol. Beta oxidation of the fatty acid and your ketogenesis, they are happening in the mitochondria. Now very simple way to remember all of this. B for beta, B for beta. बेटे को क्या पसंद है? Cat, meow. So cat is a rate limiting enzyme, that is carnitine acyltransferase 1. Carnitine acyltransferase 1. Carnitine acyltransferase 1, sir. Then coming to the next one, sir, ketogenesis. If something is cut, you have to make, so FMGE synthase. Now fatty acid is like a ghee, and ghee you will pack in a box and you will put that box in a car and you will take it away. So carboxylase. So remember, acetyl-CoA carboxylase is for the fatty acid synthesis. This is for what, sir? Your fatty acid synthesis. Ab cholesterol is good thing or bad thing? Sir, cholesterol is a bad thing and you need to reduce it. So remember, FMGE-CoA reductase. All four mnemonics given to you. Now time for you to answer, sir. Sir, beta oxidation of fatty acid is taking place in, and what is the rate limiting enzyme we have talked about. Everyone has to participate in the biochemistry in the question answer session, sir. Beta oxidation of fatty acid, what answer you are going to give? It is taking place in mitochondria. And what is a rate limiting enzyme? That is your cat, meow, Billy. Yes. Now coming to the ketogenesis. Ketogenesis, where it is happening? What is the rate limiting enzyme? Same question for all four things, and you all have to participate. It is for you guys, making you all pass. You cannot stop. You have to pass. Chalo. It is ketogenesis is mitochondria में happening. FMGE-CoA ketogenesis कट गया तो बनाना है synthase. पूरा बोलो. Fatty acid synthesis. Fatty acid synthesis is taking place in, it is taking in cytosol, and it is acetyl-CoA carboxylase. Very good. Cholesterol synthesis is again taking place in cytosol. Tell me the rate limiting enzyme. FMGE-CoA reductase. Beautifully answered by all of you. Kudos to all of you. Let's move on to the nucleotide metabolism. Sir, this nucleotide metabolism you have to read about the purine synthesis, and this is rate limiting enzyme PRPP, glutamyl aminotransferase. Just remember this thing. Now disease and the enzyme deficiency. Let's talk about the carbohydrate के अंदर आने वाले diseases. First, the first disease we are going to talk about is von Guericke disease. Sir, what is happening in the von Guericke disease? Von Guericke's disease in which the body can't break down the glycogen. The enzyme deficiency is a von Guericke. Guericke जीतना है. Von Guericke जीतना है Guericke. तो ग्लूकोज पियोगे, छक्का मारोगे, जीतोगे. तो ग्लूकोज 6 फॉस्फेटेस. रिमेंबर, ग्लूकोज 6 फॉस्फेटेस. तो वॉन गिरकीज डिजीज वेयर ग्लाइकोजन नहीं टूट पा रहा है, ठीक है, इसके अंदर द एंजाइम डेफिशिएंसी इज गोइंग टू बी द glycogen 6 phosphatase. Done. Now coming to the next one. Next importance is Pompe's disease. Next importance, what's your Pompe's disease? A disease in which body can't make protein due to the mutation of GA gene. प्रोटीन नहीं बना पा रहा Pompe's में, GA जीन की म्यूटेशन हो गई. एंजाइम डेफिशिएंसी इज Pompe इज लाइक अ पापा बहुत एसिडिक होते हैं, जहर गुस्से वाले होते हैं, थप्पड़ मार देते हैं, मुक्के मार देते हैं, डंडे से मारते हैं, तो एसिड माल्टेज. So second is Pompe's disease. GA gene is important and acid maltase is important. GA gene is important and acid maltase is important. Now coming to the third one is CoREs. Structural abnormality in the glycogen accumulated and a structurally abnormal glycogen which is accumulated in the body, and it impairs the body function. The enzyme deficiency. After C, which alphabet is coming, sir? D. So remember, D for debranching enzyme. D for what, sir? Your debranching enzyme. D for debranching enzyme. Then coming to the next one is Anderson disease. Abnormal glycogen is produced and accumulated. Produce भी हो रहा है और accumulate, same चीज. Now the enzyme deficiency. Alphabet A के बाद क्या आ रहा है? B. That is your going to be the branching enzyme. That is going to be your branching enzyme. Now coming to the another McArdle enzyme deficiencies, muscle glycogen, M for M, that is muscle glycogen. Then coming to the Hertz disease, the enzyme deficiency, H for H, hepatic glycogen phosphorylase. Then sir, essential fructose urea. Fructose is coming out in the urine and the enzyme deficiency is fructokinase. So let's revise what we have just read right here, sir. Different type of diseases. Von Guericke's disease. Number one question is Von Guericke's disease, sir. Von Guericke's. Number one is Von Guericke's disease. Can you tell me which enzyme deficiency is there in the Von Guericke? Yes, that is glucose 6 phosphatase. Very nice answers. Pompe's disease, which gene we are talking about? Pompe's disease. Number second question for all of my broad-minded medicos. Tell me, please. Pompe's disease, which gene we are talking about? Second question. It is GA gene, and which enzyme deficiency was there? Pompe is like a papa is zehrile, something hint type, acid maltase. Very nice here. Then Core's disease. Core's disease के अंदर which enzyme deficiency we were talking about? debranching enzyme. Very good. Then Anderson disease, sir. Anderson, branching enzyme. Hirsch disease, H for H, hepatic glycogen phosphorylase. Very good. Hepatic glycogen phosphorylase. Hepatic glycogen phosphorylase. Done. Now, sir, coming to the next one is essential fructose urea, where fructose was coming outside from the body. Here, essential fructose urea, here the enzyme deficiency is going to be fructokinase. Revised well, understood. Let's go. Now, sir, fructose intolerance, if we have to talk about fructose intolerance, sir. Fructose intolerance is a lack of protein which need to break down a fructose. अब fructose टूट नहीं पा रहा है, नहीं टूट पा रहा तो aldolase B. Galactosemia, sir. The enzyme deficiency is GALPUT, that is galactose 1-phosphate uridyl transferase. And in short form, we talk about GALPUT enzyme. Now, this galactosemia is associated with one feature called as lactose intolerance. Lactose intolerance. This is associated with lactose intolerance. Plus, in the eyes, what you are going to see? In the galactosemia, you will see an oil drop cataract. So, fructose intolerance is because of aldolase B, and galactosemia is because of GALPUT enzyme. Now, let's talk about the protein and their disease associated. Sir, number one thing we have to talk right here is phenylketonuria. Phenylketonuria. In this, the enzyme deficiency is going to phenylalanine hydroxylase and 𝗏𝗄𝗎 order is coming. First disease related to protein. Alkaptonuria, K for Kala. Black urine disease. And the enzyme is homogentisate oxidase. The third is maple syrup urine disease. Burnt sugar, syrup. Syrup is having a sugar. और जहाँ पे जली हुई sugar की बदबू आ रही, enzyme is BCKD. That is branch chain keto acid dehydrogenase and decarboxylase. Okay, decarboxylase and decarboxylase. Sir, done. So these are the three important proteins, their order and their enzyme deficiency. Let's revise everyone along with me. Yes, number one question is 𝗏𝗏 order is seen in this phenylketonuria. What is enzyme deficiency right here, sir? Enzyme deficiency is phenylalanine hydroxylase. Now, sir, burnt sugar order is seen in maple syrup urine. And which enzyme deficiency we were talking about in the maple syrup urine disease? BCKD, branch chain keto acid dehydrogenase or decarboxylase. Very nice. Sir, black urine disease. Which one is called as black urine disease, sir? Alkaptonuria. Which enzyme deficiency we are talking about? This is your homogentisate oxidase. Let's move on to the next one. Lipid storage diseases. Okay? Chalo. Lipid storage disease. �𝗵𝗵 disease. Number one disease we are going to talk about is �𝗵𝗵 disease. Where body fails to metabolize the lipid. Lipid fail हो जाता है, जिसकी वजह से lipid molecules you are going to see right here, sir. Cholesterol lipid, they are going to get accumulated, sir. And enzyme is �𝗵𝗵 disease. The enzyme is going to be sphingomyelinase. �𝗵𝗵 disease, sphingomyelinase. Gaucher disease. The next disease is what, sir? Your Gaucher disease. Enzyme is beta-glucocerebrosidase. And what you are going to see? This is called as, can you guess what this is called as? Crumpled tissue paper appearance. Everyone knows this. Examiner's favorite question is this, sir. Crumpled tissue paper appearance, sir. Then coming on to the next one, sir. Krabbe's disease. Now the defect is in GALAC gene, sir. Lead to demyelination. Okay? Now, sir, enzyme is beta-galactocerebrosidase. Here the enzyme was beta-gluco. Here in the Krabbe's disease, it is beta-galactocerebrosidase plus globoid cells. You can see right here, globoid cells. Other than that, Fabry's disease is there. Fabry's is alpha-galactocerebrosidase. Now, intracellular accumulation of inclusion bodies with a myelin-like appearance, you are going to see. 𝗃𝗧, where hexosaminidase is A, T is sounding like a A, Sandhoff is hexosaminidase A and B. Now it's time for you to answer my question, sir, so that we can revise right here, sir. Sir, sphingomyelinase is an enzyme deficiency for yes, �𝗵𝗵 disease. Very, very good. �𝗵𝗵 disease. Sir, hexosaminidase A is an enzyme deficiency for. Hexosaminidase is a enzyme. Hexosaminidase A and B is the enzyme deficiency for Sandhoff disease. Very nice. The Gaucher cells are seen in crumpled tissue paper appearance. Gaucher cells, they are the part of They are the part of Gaucher's disease and the enzyme deficiency beta-glucocerebrosidase. Now my next question is beta-galactocerebrosidase is enzyme deficiency for? Yes, that is going to be for the 𝗃𝗵𝗵𝗺 disease. 𝗃𝗃𝗵𝗺 disease. Very good. Sir, Gallic gene defect is associated with. My next question is, sir, Gallic gene defect is associated with. It is again associated with what? Sir, Gallic gene is 𝗃𝗵𝗵𝗺 disease. 𝗃𝗵𝗵𝗺 disease. Alpha-galactocerebrosidase is an enzyme deficiency of alpha-galactocerebrosidase. That is going to be for the favorite disease. Okay, so comfortably everyone revised. Now moving on to the nucleotide. Nucleotide mein we are having a very famous Lish-Nehan syndrome where self mutation is there. Cell multilation is there, not mutation, cell multilation. You will eat, the person who is having will eating the nails, eating the lips, etc. Here you will see the enzyme is 𝗃𝗃 HGPRT. It is going to be the 𝗃𝗃 HGPRT. HGPRT is the name of a girl who loves to eat the nails and lips. This is how I have remembered for my exam and going to teach my students too. Now let's talk about, sir, amino acid and their special product. Let's talk about that, sir. Sir, tyrosine. Tyrosine is a special product of T3T4 catecholamine and melanin. Tyrosine के आगे special product कौन से हैं? T3T4 catecholamines and melanin. Let's talk about T3T4 catecholamines. What are the catecholamines? Epinephrine, non-epinephrine. So these are the catecholamines we have plus melanin. Melanin का function क्या होता है body के अंदर? Sir, tannin को बढ़ाना. ठीक है? Tannin को बनाना. Done, sir? Now, sir, tryptophan, T40. Why T mean B3? Sir, T-tonin, melatonin. ठीक है, मेलाटोनिन ये स्लीप साइकिल के लिए हेल्प होता है. ठीक है, चलिए, तो ट्रिप्टोफैन इज टीटी वाला, विटामिन B3, सेरोटोनिन, मेलाटोनिन. नाउ सर हिस्टिडीन, हिस्टामाइन. हिस्टामाइन क्या करेगा? वैसोडाइलेशन, ब्रोंको कॉन्स्ट्रक्शन. वैसोडाइलेशन एंड ब्रोंको कॉन्स्ट्रक्शन. सर आर्जिनिन कौन आगे क्या प्रोडक्ट है? नाइट्रिक ऑक्साइड. नाइट्रिक ऑक्साइड क्या कराता है सर? वैसोडाइलेशन. वैसोडाइलेशन. ठीक है, देखो अच्छे से देख लेना, बहुत दिनों बाद देखी तो. चलो इनहिबिटर की बात करते हैं. इनहिबिटर की बात करेंगे तो फ्लोराइड, बार्बिचुरेट, रोटिनन, मेलोडोनिन कॉम्प्लेक्स 1, 2, 3, एनोलेज. What they are inhibited? These things are also equally important to remember for the exam. My dear ladies and gentlemen, fluoride is inhibiting enolase. Barbiturate, rotinon, complex 1. Malonate is for complex 2. Carbon monoxide, cyanide and hydrogen sulfide is for complex 4. ठीक है. Now can you add here? Malonate के साथ में ऐसी कौन सी चीज है जिसको complex 2 inhibit करता है? Can you keep adding the stuff here? Malonate के साथ में कौन ऐसे प्रोडक्ट हैं जो और ऐड होंगे इसके अंदर? Malonate के साथ में सर एंटीमाइसिन A प्लस बाल, एंटीमाइसिन A प्लस बाल, एंटीमाइसिन A प्लस बाल. Oligomycin, it is complex 5. Oligomycin, it is complex 5. Now it's time for question answer session in the group itself. Sir, enolase. Complex inhibitor is enolase. Who is inhibiting enolase? Fluoride, complex 1. Complex 2, malonate. Very good. Complex, अरे 3 है ही नहीं क्या लिखा हुआ? होता ही नहीं है. चलो malonate हो गया. Complex 4, carbon monoxide, cyanide, hydrogen sulfide. Complex 5 is by oligomycin. Very, very nice. Now let's talk about the next topic called as classification of amino acids. So far so good. Everything is going comfortable according to you. Okay? Because this is completely a mugging biochemistry wala part. Almost mugging. Okay? So let's mug it nicely and then switch on to the next 6 subject of today's day 1 class, and that is going to be the microbiology. Physiology done, anatomy done, pathology done, pharma done, micro done, biochemistry done, and sleep cycle improvement, result improvement done, sir. Chalo, let's move on this one, sir. Classification of amino acids. Sir, first of all, aliphatic. Aliphatic is like a elephant, sounding like a elephant. एलिफेंट कौन हो जाता है? जो गौतम नगर जाता है. गौतम नगर में क्या खाता है? परांठे. तो जी वाली मतलब गौतम नगर वाली is a mnemonic to remember the aliphatic amino acid. It is for the aliphatic amino acid. G stands for glycine, valine, alanine, your leucine and isoleucine. Just you remember the mnemonic, rest of the name automatically will come to your mind. So G for glycine, valine, alanine, leucine, isoleucine. Done. Now hydroxyl group containing amino acid are ST. S for serine, T for threonine. S for serine, T for threonine. Now sulfur containing, तो sulfur या sulfur हमें कौन कराता है? MC people. So write it right here sir, MC, that is methionine and cysteine. Now sir, acidic amino acid is ARG. Acidic amino acid is what sir? ARG. Sir, ARG is a mnemonic for acidic. So first of all, एलिफेटिक के लिए क्या आता है? G वाली. हाइड्रोक्सिल ग्रुप के लिए क्या आता है? ST. सल्फर ग्रुप के लिए क्या आता है? MC. और नाउ एसिडिक में लग गई आग, तो आग लगे तो क्या करना है? भाग मिल्खा बाग, मिल्खा बाग, मिल्खा बाल. And yes, antimycin A and BAL is complex 3. Thank you so much. I'm very extremely thankful. There I was missing something, and that is what? Complex 3 is antimycin A and BAL. That is in the category of 3. ठीक है, चलिए, thank you so much. चलिए, A for aspartic acid, A for aspargine, G for glutamic acid, G for glutamine. Aspartic acid, aspargine, glutamic acid and glutamine. Then coming on to the next one, sir, basic amino acid. तो क्या है? Basic nature कैसा है human being का? How the basic nature is there of a human being? किसी का हाल पूछना. Basic amino acid. Basic amino acid, H for histidine, A for arginine, L for lysine. Histidine, arginine and lysine sir. Then coming aromatic, अगर आप खुशबू लगा के आओगे तो सामने वाला इम्प्रेस हो जाएगा. इम्प्रेस होने को क्या बोलोगे सर? पट जाएगा. तो P for phenylalanine, tyrosine and tryptophan. Phenylalanine, tyrosine and tryptophan. अब essential amino acid TV till 8 PM. Tryptophan, V for valine, threonine, isoleucine, leucine, lysine, P for phenylalanine, methionine. 7 हो गए. Then semi-essential amino acid. What are the semi-essential amino acid? Semi-essential amino acid. That is HA, histidine and arginine. Histidine and arginine. Histidine and arginine sir. Now कट गया ketogenic, कट गया प्यार में, कट गया LL. Leucine and lysine. Leucine and lysine. Leucine and lysine. Leucine and lysine. Now glucogenic and ketogenic amino acid. It is PIT. Phenylalanine, isoleucine, tryptophan, tyrosine. 21 is selenocysteine, 22 is pyrrolysine. Now it's time to ask you question regarding the mnemonics. Sir, I will just take a white screen and I'll ask you the question. Number 1 question. Sir, PTT is a mnemonic for aromatic. Very good. Sir, ST is a mnemonic for? Sir, MC is a mnemonic for? Sir, HAL is a mnemonic for? HAL. Basic amino acid. Basic amino acid. So we are good so far. So far, so good. Now let's talk about some miscellaneous topic. Here we are going to talk about the uncouplers. Some one-liners we are going to talk about, sir. And one repeated question is going to come from this. Uncouplers, if we talk about physiological, 2,4-DNP and aspirin is going to be the uncouplers of the reaction chain. Lipoprotein. Now one liner is coming for all of you. So lipoprotein highest cholesterol is LDL. This is low density lipoprotein, bad cholesterol. HDL is a good cholesterol. HD is a good cholesterol. LDL is a bad cholesterol. So lipoprotein with the highest cholesterol is LDL. Lipoprotein with the highest triglyceride, chylomicron. Triglyceride is chylomicron. Nature of enzyme can be apo and coenzyme मिलके बोलेंगे holoenzyme. Now competitive and non-competitive आपको मैंने पहले भी बताया था. Competitive and non-competitive I am going to ask you. Competitive and non-competitive. Now this is competitive and non-competitive. This is Kmax and this is Vmax. What will happen right here, sir? First question. If competition is there, what will happen to the kilometer? If competition is there, what will happen to the kilometers? If competition is there, what will happen to the? Sir, competition में क्या हो जाएगा? किलोमीटर बढ़ जाएगा. Vmax क्या रहेगा? Same. What about non-competition? अगर कंपटीशन नहीं होगा तब क्या होगा? किलोमीटर क्या हो जाएंगे? इफ देयर इज नो कंपटीशन देन व्हाट विल हैपन? सर के मैक्स के अंदर क्या होगा सर? किलोमीटर विल बी सेम एंड वी मैक्स विल बी डिक्रीज्ड. सेम एंड वी मैक्स विल बी डिक्रीज्ड. वेरी वेरी गुड, वेरी वेरी गुड सर, वेरी वेरी गुड सर. ठीक है. Now protein folding and misfolding is done by, my dear friends, protein folding and misfolding is done by, your answer is previous year question, that is your chaperone. That is what sir? Your chaperone, chaperone, chaperone. Let's talk about the vitamin also sir. Vitamin sir, vitamin. The next topic is vitamin, very important. At least 2 to 3 MCQs are itself these days coming from vitamins. If you revise these 2 to 3 topics, that means you are good with the vitamins, sir. Now let's talk about the vitamin topic, sir. Vitamins are divided into, first of all, fat soluble and water soluble. Who are water soluble? They are BC. कहते हैं BC पानी डाल, इतना डाला है और डाल. And fat soluble is ADEK, in which K is dogla. It is having 3 form, K1, K2, K3. K1 and K2 are lipid soluble. K3 is what, sir? Fat soluble. They are what, sir? Your fat soluble. Now vitamin A, if we talk about the active form of vitamin A is retinol. And if there is a deficiency of vitamin A, it will lead to a clinical site called as Biotod spot. Can you tell me which is the most common source of vitamin A? Halibut, fish, liver oil. Very good. How much vitamin K you should give to a person? Less than 6 months, 6 months to 1 year, and more than 1 year, sir. Can you tell me what is a vitamin A ka dose we have to remember for the exam? Vitamin A, international units mein please, 50K. Sir, 1 lakh and 2 lakh. Sir, if more than 12 months but weight is less than 8 kgs, then what you are going to do, sir? More than 12 months and weight is less than 8 kgs, then again the dose is 1 lakh. Again the dose is what, sir? 1 lakh, sir. Now coming to the next one is vitamin D, sir. Active form is 1,25-dihydroxy-D3. 1,25-dihydroxy-D3. The deficiency in children is going to be rickets. And deficiency in adult is good. Rickets के feature कोई 2-3 बता सकता है मेरे को? What are the features of rickets we can see, sir? Craniotapes we are going to see, sir. Rickets के अंदर wind sweep deformity can also be seen, sir. Osteomalacia के अंदर which zone you are going to see? Just tell me the name of a zone you are going to see, and I'll come to know that you people know the stuff. Osteomalacia, yes. Osteomalacia के अंदर loser zone. Loser zone, you are going to see the loser zone, sir. Now coming to the next vitamin is vitamin E. Anti-inflammatory action is there. Okay. Vitamin E deficiency is there. Cancer, cellular damage can happen most commonly. Active form is tocopherol. Active form is tocopherol. Even some people use this vitamin E capsule on the hairs also. Okay. It stops the inflammation. Hair growth जो है करने में help करता है. Now vitamin K we were talking about, sir. Vitamin K, who is the antagonist? Pharma question. Antagonist of vitamin K. Who is the antagonist of vitamin K, sir? Sir, the answer is warfarin. Answer is warfarin. Very good. Warfarin monitoring is done with the help of, another question coming for all of, warfarin monitoring is done with the help of PTINR. Sir, warfarin is an anticoagulant of choice in pregnancy. True or false? Just write it down. Understand my statement once again. Warfarin is an anticoagulant of choice in the pregnancy. True or false? It's false. Then my next question is, who is the anticoagulant of choice in pregnancy? That is low molecular weight heparin. Or uska APTT. What is the antidote of heparin toxicity? Now another question coming up for all of you to make you all wake up and make you all realize that you studied well. Yes, antidote of toxicity of low molecular weight heparin, or you can say factor 2A inhibitor, which we have talked about. Protamine sulfate. Vitamin K is further divided into K1, K2, K3. We have talked about K1 and K2 are lipid soluble and K3 manadine is water soluble. Deficiency will lead to bleeding disorder, which all you people have answered very well. Now vitamin B1 is thiamine. It will lead to Wernicke-Korsakoff syndrome and Beriberi syndrome. Can you tell me the feature of Wernicke's this Korsakoff syndrome? GOA. GOA stands for global confusion, ophthalmoplegia. Very, very good. Very, very good. Now riboflavin will have a deficiency. Riboflavin is a B2 का नाम दूसरा वाला, and deficiency will lead to glossitis, neural dysfunction, dermatitis. Now vitamin B3 is important. Niacin deficiency will lead to pellagra. Pellagra is having 4D. 3 Ds are written right here, sir. Dementia, diarrhea, dermatitis, which is a 4th D we are missing right here, sir. Which is the 4th thing we are, death, yes. Dementia, diarrhea, ठीक है, चलिए. Vitamin B is pentathonic acid. Vitamin B5 is pentathonic acid. Deficiency will lead to burning feet disease. Burning feet disease, sir. Next is vitamin B6, pyridoxine. Pyridoxine will lead to anemia. Which type of anemia? Vitamin B6 will lead to, sir. This is having a pernicious anemia. Vitamin B7 is nothing but biotin deficiency will lead to hair loss. Vitamin B9, folic acid deficiency will lead to megaloblastic anemia. Megaloblastic anemia plus neural tube defect. Can you tell me how much dose you will give of a vitamin B9 folic acid to a pregnant mother to avoid the prophylactic dose? कितना दोगे to neural tube defect stop करने का? How much dose we give to a pregnant female? What if she is already having, then we give 4000 microgram, otherwise 500. If already she had a history, then we give a 4000 micro mcg. Okay, very nice, good. Now vitamin B12 is nothing but your cobalamin, ethylcobalamin, and it will lead to megaloblastic anemia. Plus vitamin B12 helps in the myelination. If myelination will not happen, there will be a disease called as subacute combined degeneration of the spinal cord. Subacute combined degeneration of the spinal cord.